Alice, can you just talk about what celiac disease is? I think that can kind of run the gamut, can it?
Well, celiac disease is the most common autoimmune disease, most underdiagnosed autoimmune disease. And basically what it is, it's when somebody has celiac disease, they cannot digest the protein in wheat, rye, and barley. And that protein component is called gluten. So the person has to be on a gluten-free diet. That's the treatment for the disease. And it happens to be an autoimmune disease, a very serious autoimmune disease.
Okay, since it's autoimmune, do we know how people contract this at all, or?
It's a hereditary disease,
Okay.
so but 30 to 40% of the population has the gene, but only about 1% of the population will express the gene. And there's 300 signs and symptoms of celiac disease. So on our website at celiaccentral.org, there's a symptom checklist where you can go check the symptom and then ask your doctor to test you for celiac disease. Mm-hmm. The first step is a blood test.
Okay. Well, you said there's a symptom list, and there's many of them on there. Is this commonly misdiagnosed, and what are some of the ways or what are some of the other conditions that it's incorrectly diagnosed as?
You hit the nail on the head. So the patient typically comes in, the sufferer, the undiagnosed celiac, and with a symptom. They get treated for the symptom. So oftentimes it gets lumped into something like irritable bowel syndrome. For me, I had reproductive health. So if from top to bottom, my symptoms were I had a full-term stillbirth, 3 miscarriages, a 2-pound baby, I lost 25 pounds, I had tingling in my fingers and toes, I had migraine headaches. So I was walking around with all these symptoms, and I went from doctor to doctor. So whatever the symptom was, migraine headaches have Imitrex, and so what the symptom typically gets treated with, an underlying cause of the symptom is not investigated when it is a blood test. It's an antibody test.
How dangerous is that if you go from symptom prevention to symptom prevention and get all these different drugs to try to take care of the symptoms when it could in fact take a while to actually understand the disease you have? I mean, you're dumping a lot of things into your body before you potentially understand what you actually have.
Exactly. I mean, it takes the average person 6 to 10 years to get properly diagnosed. There was one woman who contacted me, looking for a doctor. She was on 12 kinds of medications before she was properly diagnosed with celiac disease. She got the diagnosis. She went on a gluten-free diet. Now, it's a lifestyle change, so you have to cut wheat, rye, and barley out of your diet. But she's now only on one medication for her thyroid, and that's it.